Hi, my name is Diana. I am 16 years old. I currently live in Portugal, but originally I am Ukrainian. I'm as well right now an incoming senior in high school. So let's start with my scoliosis story. So let's talk a little bit about the beginning of the journey and my diagnosis. I was diagnosed actually when I was 5 years old in first grade. When I remember when I was showering and my mom was helping me because I was still 5 years old, and she looked at my spine and she noticed like a slight curvature. I remember my dad always told her, "Oh, you're over exaggerating." But when we went to the doctor, they found out I actually had an S-shaped curvature. I had 28 degrees on top and 23 degrees on the bottom. That is a lot for a person that is 5 and still has so much growing ahead of them. And my parents were told by the surgeon like that in the future, I would most likely have the surgery. And my parents didn't want to believe it. They were like, how can you be so certain? She's still so young. There's so much time to fix this. So they just threw me with like everything, like physiotherapy, swimming, gymnastics. I was doing everything. I was doing swimming 3 times a week. I was doing gymnastics twice a week and physiotherapy once a week. And actually, after a year, I came back to the doctor, and my curvature in the top decreased by 5 degrees, and my curvature in the bottom decreased by 3 degrees. So there was progress. He even asked us to write down exactly what I was doing, what kind of physical activity, because he has never seen something like that improve just with sports and physiotherapy. Even though this was the case, 2 years later, when we came back to the doctor, my curvature progressed and I already had 30 degrees at the top and 20 plus degrees at the bottom. And due to this, he proposed a nocturnal brace. And personally, for me, I was just starting fourth grade, and I did not really see a big deal in using this brace. I mean, it looked scary, but at the same time, I was like, I had that mindset of like, okay, I'm just gonna use it during the night. It's fine. No one's gonna see me with it. So, but I didn't really understand that it would be very painful. So I remember the first time I used it, I cried a lot myself to sleep because I just couldn't bear with the pain of the night brace. I don't know if it's just personally I couldn't bear it because I know for a lot of people it worked, but for me personally, I could not sleep. I would have like 2 to 3 hours of sleep per night. And because of this, me and my parents decided it would be best for me not to continue this treatment. So I did this treatment for around a month, but then we just decided not to because I couldn't focus in school. It was terrible. I was moody constantly because of the lack of sleep. So unfortunately, this treatment didn't work for me, even though I tried. Obviously, because I wasn't doing the nocturnal bracing, all the sports I was doing was also not enough. My curve progressed, and because of this, they asked me to use a Boston brace, and I had to use this 20 hours a day because my curve progressed very severely, and I used it up from 5th to 8th grade. It was terrible as a kid because I was a kid with so much energy, and I was very sporty. I wanted to do everything, but because of this brace, I as well quit gymnastics because first of all, because of the pain that scoliosis brought me, it was impossible to continue gymnastics. And because I had to use it 20 hours a day if I wanted the curve not to progress. After a while, I also even stopped doing swimming because it was very painful as my curve was around 60 to 50 degrees at some point. I remember I would walk for 30 minutes without the brace when I would be going out with friends once in a while, and I just couldn't bear it. I had to go back home, put it on, and continue. I was pretty consistent with the bracing because of this, because I couldn't bear being without it because it was just way too painful. Because of this, obviously when we went back to the doctor, after hearing me complain that I was in a lot of pain, he told me that at 13 years old, it was better for me to do the surgery. And when we did the x-ray, I actually already had 75 degrees on top and 65 degrees on the bottom. And in fact, this affected a lot of my self-esteem in general as well. So as a 13-year-old self, I didn't really understand this surgery very much. So a lot of people I hear are very scared to undergo surgery, and that's obviously very comprehensible. But as a 13-year-old, I didn't really understand it. I was like, as long as the surgery like stops the pain, I'm willing to go for it if it's the last step of the journey. And I wanted my self-esteem back because with the brace especially, and with a S-curve in my spine, I did not look my best. And um, I suffered actually a lot of bullying because of it in high school. Not in high school, middle school, I mean. So spinal fusion was the only solution. And I remember waking up after the spinal fusion, and it was terrifying because even though I didn't understand how severe all of this was, the moment I woke up, I understood it as a 13-year-old. And because first words that I told to my mom was, "Mom, if I had knew this would be this painful, I would never have agreed to this." Even though this was the case, as you can clearly see on the screen, the results of the surgery were amazing, especially looking back at the curvature I had. That was very severe. And yeah, it was, the recovery process was just very tough for me. And especially the first week at the hospital, I was regretting everything I was doing because I didn't know it would be this painful. And my doctor, he was transparent with me in terms of this is not going to be easy, but he didn't really tell me to which extent would it be painful, obviously, because I was still very young. And if he had told me, I would probably not want the surgery and would probably be like, no, I don't want to do it. This is a video that actually my mom took of me so I could look back and realize how strong I was at the moment, and that this journey was all worth it in the end. And my recovery process. Once again, as I mentioned, when I was a little kid, I was very active and I loved the active lifestyle. And after surgery, that's what I tried to do. So I continued with swimming, and I even considered competition, but then I was just like, no, I want to swim for myself. So I continued swimming 4 times a week, actually. And I also went hiking with my friends. This is like a year later after surgery, after building some muscle in my back. I was able to go hiking and even carry some weight on my back that I was very surprised that I didn't endure any pain. And for me, that was, I remember I actually teared up after the hike because I was so amazed that I was able to do a hike of 30 kilometers with a backpack on my back. And yeah, it was just amazing. I'm also able to do 10-kilometer runs right now. And I remember I told that to my doctor, and he was just very proud because running especially is very hard after surgery. And so how am I doing right now? And was this all worth it? In my opinion, it really was, because after the surgery, my self-esteem just went really up. I even started doing modeling because I wanted to prove to myself and to others that even though I have this huge scar on my back and that I have all of this story, that I'm still able to put myself out there and um, just show that you don't need to be perfect to enter these kind of industries, and that it built my confidence in manners that I could never imagine. I also got very inspired with my journey to sing. And because of my scoliosis, I actually started having singing classes because that was what helped me cope throughout the whole recovery process. And even right now, um, I am doing solidarity concerts for Ukraine. And this is all thanks to my surgery, once again, because I started singing because of my surgery. And yeah, I just couldn't be more grateful that I had this experience. And yeah, and I wanted as well to say a huge thank you to the Setting Scoliosis Straight Foundation for letting me share my story and hopefully inspire others to get through this journey.
Hi, my name is Michelle, and I am from Pennsylvania, and I'm going to be a rising junior in high school next year. And I was diagnosed with scoliosis when I was in seventh grade, and I wore a Wilmington brace for about a year and a half. And luckily, my curve was stabled at around 35 degrees, so I didn't have to undergo surgery, which I'm very fortunate to have been doing so. And Deanna, I really liked your story. It's so amazing. And the first question I have for you is related to bracing. So I know you did bracing in the very beginning and it was really difficult. So, do you have any tips on how to stay consistent for patients who are bracing? And even though like it was too painful for you at the end, yeah, I was just wondering how you got through it in the beginning.
Thank you so much for your question. And yes, I agree, bracing can be very tough. And as I mentioned in the beginning, nocturnal bracing didn't work for me. So I feel like it's as well a question of you trying to see what works best for you. For me, the day brace worked better because I had a lot of pain walking. So for me, it kind of, since the very beginning, I really just needed to wear it because I would feel I would have a lot of pain. And as well, what motivated me a lot were my parents in that sense, because they constantly told me that if I didn't wear this, the only option would be surgery. And obviously, when you're little, even though I didn't think it was such a huge deal, like I would rather not have a surgery. So I guess as well, keeping that whole process in mind. And I feel like mentally I was a very determined child. I really wanted to fix it. So I guess mentality is very important, and I feel like it's as well very important to for a person to understand that they should ignore what others say, because this is your life and you're doing this for your own health, your own benefits. And even if others start calling you names or laugh about you, it's your life. You're doing this for your own good. It's not their good. They're still kids. They're still immature. They'll probably grow out of it. They'll probably understand that they made a mistake while bullying you or shaming you. But you should know your own truth and ignore others. And trust me, like the moment I started ignoring them, the moment I just didn't respond to their sarcastic comments and just laughed at their face, it was the moment that they stopped because they realized that they couldn't get to me and it wasn't really funny for them. So it's really a matter of mentality. Thank you so much for your question.
Yeah, I think that's great. It's wonderful how like since you were little, you had such a good mindset when you were bracing. My second question for you is that do you wish that there were any resources or support that was out there when you first found out you had scoliosis? And do you think that would have made your treatment process any different?
Actually, yeah, I really wish there was like sets of organizations or like people who had scoliosis, like groups. No one really told me. I know that right now there are support groups for it, but when I was little, my parents didn't know much about it, and my doctor didn't really tell me there was such a thing. So I was never really aware that this was actually an issue that a lot of people had. Like, I didn't know that majority of people had scoliosis. This is something I just realized while growing up and after my surgery, actually. Before, it felt very isolating in a way. And yeah, I really wish there was like a support foundation, because I feel like even though I had a very determined mindset, I feel like it would help me a lot mentally because it was still not easy.
Thank you so much, Deanna. Thank you for answering my questions, and I'm gonna pass it on to Kat now.
Hi, I'm Catherine, and I'm also going into my senior year of high school. And I was first diagnosed with scoliosis when I was in sixth grade, and I wore a Boston brace for 2 years. And so I just want to say, Diana, that was an amazing story. Thank you so much for sharing. And my first question is, how was your experience transitioning back into sports and physical activities, like you mentioned, swimming, running, and hiking after surgery?
Well, I'm gonna be honest with you, even though it sounds like rainbows and unicorns, I started doing sports like right afterwards, right after 6 months. It really wasn't, in the sense of the first sport that I started doing was swimming, because my doctor told me it would be easier for me, especially since I have done it for quite a while. But it was very painful at first because I didn't have any muscle on my back. So just swimming on the speed that I did previously was like impossible. So I kind of had to start from zero and just rebuild that muscle. And it was honestly very tough. And I had to tell myself that I need to train, even though it was a little bit painful, through it and do it consistently for there to be results for me to be able to do more things. And after I went through that tough phase, you may say, then it just became easier because I had built some muscle on my back. So I was able to do running, even though it was hard in the beginning, once again, because running, I think, after spinal fusion, it's pretty hard, but it was definitely doable. And it's just pushing yourself a little bit to your limits. Obviously, talking to your doctor about it, discussing whether it's okay for you to do a certain thing like hiking. Like my parents personally thought that I could never do it. I shouldn't do it. But my doctor, seeing how I'm progressing in terms of physical activity, told me, you know what, give it a try. See it, because he knew I really wanted to do it, and I managed to do it. So it's a question to seeing where's your limits and how determined you are to start physical activity again.
That's amazing. Thank you for that response. And then my second question is that you mentioned using your journey with scoliosis as an inspiration for your songwriting. Could you share something that you learned about yourself from your experience with scoliosis?
I definitely learned that I'm a fighter, because this is something I never really thought about throughout my whole journey. And I would constantly, sometimes, I remember actually writing in my notebook about it when thinking about a song lyric. And I was like, damn, like a lot of the times, like especially people who undergo such tough journeys as people who underwent spinal fusion or bracing, bullying, like we don't realize like that we're fighters, that we're so strong to in a way that um others can't really see. Because when I tell other people that, oh, I have scoliosis, they don't see it as a big deal. They're like, oh, I also have scoliosis. Like they have like a 15-degree curve that, it's not the same thing as someone who underwent pain through it. And I feel like that's one thing I learned about me, even though it sounds kind of cliche, but it's true. I really learned that I was strong and I was very determined, and that definitely inspired and gave me confidence to write songs and hopefully share them in the future, because I'm still very new in the whole process of songwriting.
Thank you so much for answering my questions. And then now I will pass it to Ava.
Um, so I just want to say, Diana, your story was so incredibly inspiring. I'm Ava. I was diagnosed with scoliosis at 9 years old. I was prescribed a brace for 2 years, and I had scoliosis surgery last summer. So my first question is, has the scoliosis surgery posed any limitations for you today? Like what specifically can you not do? Yeah.
Oh, that's very interesting, because I tend to see more in the aspect of what can I do. So only this year I was able to like actually reflect, okay, what can't I do? And I feel like really it's just the basics in terms of I can't bend. So naturally, if I want to like pick something up, I have to squat. Or what I as well realized that was a limitation is trampolines, for example. I This is personally, I really can't jump on a trampoline because it really hurts my back. But in terms of limitations, I was very surprised that I don't have much. Once again, what helps me a lot is that I'm very physically active. So I build muscle on my back, and I feel like that helped me a lot in recovery. I can go on roller coasters, I can go diving, I can go hiking. So I personally, to think about like limitations that really impact me severely, I can't think really of any. Like I can do much more than I did before my surgery. That's for sure something I can say.
Yeah, that is so amazing. Yeah, I remembered in your PowerPoint, there were like so many things you're doing, like running and the hiking. I was like, oh my God, I was like, wow, that's so impressive. And my second question is, do you have any advice for young women struggling with scoliosis, maybe who are about to undergo a similar surgery?
Yes, be confident. I know it's hard. I know, especially because I wasn't confident at all when doing bracing. But the moment I started to make others believe that I'm confident, right, in myself and in my recovery, I noticed the difference between how others reacted to me, how they reacted to things I do. So confidence really is key. For example, even I'm going to give an example for my modeling agency right now. Um, especially my mom even asked me this because it's true. I mean, she was like, okay, you have a huge scar on your back. Do you really, think you should go or not? And I was like, but who cares? If I wear it with confidence and like if they don't want me because of my scar, then it's their loss, like it's part of your journey and I'm never going to be ashamed of it. And I remember I went to actually an interview with my agency and they got really inspired. They were like, "Oh my God, we actually really like that about you." And what a lot of individuals don't realize is that all the things that sometimes make us very insecure are something that other people look up to and feel very inspired about. And I've noticed this a lot in the modeling agency because there's some people with different scars, different signals, and they're not all perfect. And that's what makes them very special. And that's what and they get a lot of jobs because of that, because the modeling industry is shifting right now. And they want people who are unique and who have a story to share because it's better for their publicities as well. And yeah, I feel like you can do whatever you want to do, but you need to have confidence in it. That's definitely my number one tip.
Yeah, that's amazing. Thank you so much for answering my questions.
Thank you so much for letting me share my story. I hope it inspires individuals struggling with scoliosis. And remember, confidence is key and you can do anything you want to do.